Greetings to those who will be watching this viral report concerning viral hepatitis. We will be discussing this in this video. So let's start. What is viral hepatitis? Viral hepatitis is a systemic viral infection in which necrosis and inflammation of liver cells produce a characteristic cluster of clinical, biochemical, and cellular changes. And this viral hepatitis is very contagious or easily transmitted. Because of its highly contagious nature, 60 to 90% are unreported. And that being said, because of such cases in the scenario of unreported cases, the global health sector strategy, according to World Health Organization, has seen this as a problem. Therefore, they have a goal which calls for the elimination of viral hepatitis as public health threat by 2030, which means reducing the new infections by 90% and mortality rate by 65%. Now, what is viral hepatitis? We have In my video discussion, I will be talking about viral hepatitis A, B, C, D, and E. And out of all these five, there is only one virus that is a DNA virus. What is a DNA virus? A DNA virus has two strands of ribonucleic acid, while RNA on itself has only one. So, what is the difference between DNA and RNA? For DNA, there are two strands. For RNA, there are one strand for ribonucleic acids which contain the genetic information of the virus. Okay, so let's start with a simple video of the pathophysiology of the virus. This video will be specific to virus of hepatitis C, but which does the same physiological reaction to all other virus.
During the early or acute phase of a hepatitis C infection, the hepatitis C virus enters your liver and invades your liver cells. Once inside your liver cells, the virus begins to make copies of itself. During the copying process, changes called mutations occur frequently in the virus's genetic material, leading to new strains of the virus. In response to the viral infection, your body sends immune cells to attack both the virus and the liver cells infected with the virus. As a result, these liver cells become inflamed and then die.
That's
Over time,
apoptosis.
scar tissue forms around dead and infected liver cells.
And
The
these
scar
are
tissue prevents your liver from working properly.
tissues,
If you have a chronic hepatitis C infection, your liver contains a large amount of scar tissue called cirrhosis, which limits blood flow and results in permanent shrinking and hardening of your liver.
All right. Therefore, let's discuss the first virus, which is hepatitis virus A. It's formerly called infectious hepatitis. The mode of transmission of this is fecal-oral route. For sanitation, person-to-person contact, waterborne, foodborne, transmission possible with oral anal contact during sex. Incubation period is 15 to 50 days. So symptoms does not show until about 15 to 50 days. Now, what do we see with those people who have hepatitis A? What can we assess and what are the diagnostic findings? The liver and spleen are often moderately enlarged for a few days after the onset of the symptoms or during or after, rather, the incubation period. And usually the person suffering with hepatitis A has a jaundice, the yellowing of skin, the sclera, or the high bilirubin levels in the serum liquid. The diagnostic procedure is hepatitis A antigen may be found in the stool a week to 10 days before illness and for 2 to 3 weeks after symptoms appear. Hepatitis A virus antibodies are detectable in the serum, which and usually not appear until symptoms appear. So in order to see the HAV antibodies, the symptoms must usually first appear to detect the antibodies of hepatitis A. Analysis of subclasses of immunoglobulins can help determine whether the antibody represents acute or past infection. So it can determine if you have the infection of hepatitis A just recently in the past few weeks or months, or it has been a past illness that is being detected or just being diagnosed just now. Okay, what is the nature of illness of hepatitis A? The signs and symptoms may occur with or without symptoms. Flu-like illness, this is what they experience. In the pre-ecteric phase, ecteric means jaundice, basically the start of jaundice, ecteric. So before jaundice phase or pre-ecteric phase, headache, the patient will feel headache, malaise, fatigue, anorexia, and fever. In the ecteric phase, the jaundice phase, the patient will suffer of dark urine, the patient will show jaundice of sclera and skin, and tender liver. So they will have abdominal pain on the right upper quadrant. So again, many patients though are anecteric. Um, for those who are without symptoms, but when symptoms appear, they are of mild flu, like upper respiratory tract infection with low-grade fever. Anorexia, an early symptom, is often severe. So let's remember that anorexia or the malnutrition will be a great problem for hepatitis infection. Okay, let's continue with the nature of illness. What is usually the outcome or the prognosis? Well, usually those people infected with hepatitis A virus will have mild recovery and a fatality rate of less than 1%. So of all the cases, only less than 1% will have a risk of dying. Um, if you are infected with hepatitis A virus, usually you are not a carrier state or you are not in increase of chronic hepatitis, which results to cirrhosis or hepatic cancer. Okay, what is the medical management for hepatitis A? Well, because of the malnutrition and the weakness of the patient suffering from this infection, we have to provide complete bed rest to minimize exertion of energy and promote healing. Frequent small feedings. Why? Because of anorexia. Usually those patients who have hepatitis A will suffer with low appetite. And to supplement, we have to give the patient with IV with glucose so that the patient will have enough energy to sustain. And then as the patient recovers, we need to start with persistent stimulation, with persistent or progressive abulation. And going back with anorexia, um, because of the loss of appetite, we have to be consistent to stimulate the appetite so that the patient will have the proper nutrition in his daily demands. Okay, now what is our part as nurses? Usually, people who are infected with hepatitis A are managed at home. However, if it's severe, usually patients will be admitted to the hospital depending on the severity of the symptoms. Assist the patient and family in coping with a temporary disability and fatigue is one of the nursing um, management and plan. Instruct to seek additional health care if the symptoms worsen, just like I said earlier. Guidelines for diet, rest, blood work, avoidance of alcohol. Why? Because if you drink alcohol, you will be your liver will be on much harder work, which it will be tackling both the infection and then the toxic nature of the alcohol. So the liver will be in much um, exhausting work. And then because of the highly contagious nature of the hepatitis A virus, we have to observe hygiene measures to prevent the transmission or spread, which is, as we know, it can be contact to contact. It is a fecal oral route. Make sure that after using the restroom, um, we apply proper and meticulous hand hygiene. Specific teachings to patient and families about reducing the risk of contracting hepatitis are included. A good personal hygiene, just like I said, stressful, careful hand washing after bowel movements, and sanitation of water supply as well as effective sewage disposal. So, with that being said, this is mostly apparent or applicable to places or countries that are developing because of poor plumbing or sewage system that usually that they have. So extra precaution if we travel in those places. Now we have a prevention for this. We have vaccine, Habrix and Bacta that last for 20 years immunity. Vaccination for high-risk group, especially for those who practice in anal oral sex, which is prevalent to homosexual men, those who are IV drug users, and especially our healthcare personnel who cares for those high-risk groups or those who practice dangerous practices. Intramuscular administration of globulin during this incubation period is given within 2 weeks of exposure. Immunoglobulin is also recommended for household and for those members that has multiple sexual contacts of people with hepatitis A. Susceptible people in the same household as the patient are usually also infected by the time the diagnosis is made and should receive immune globulins. Also, pre-exposure prophylaxis is recommended for those traveling to developing countries, just like I said. So they will need prophylaxis if they will be. It is recommended, not really that they have to, but it is a recommendation that they take prophylaxis to prevent contracting hepatitis A virus. Now let's go to hepatitis B virus. Formerly called, it was called before as serum hepatitis because it is the mode of transmission is parenterally by intimate contact with carriers or those with acute disease, sexual or oral to oral contact, perinatal transmission from mothers to infants, an important occupational hazard, obviously for healthcare personnel, especially in the delivery room. Now this one has a longer incubation period, which is 28 to 160 days. As you can see, this is basically the illustration of the hepatitis B virus. This is the inside is the DNA, and it is enveloped with this nuclear envelope. Okay, and then with all the antigens or receptors on the protein envelope. Okay. Now, how do we assess or what can we see during our assessment to those patients suffering with hepatitis A? Actually, Those who have hepatitis B virus will also experience just like the hepatitis A virus. So they have fever and respiratory symptoms, but they are usually rare. So jaundice may or may not be evident. So there will be no icteric episode. However, the liver may be tender and enlarged to 12 to 14 centimeters vertically. That is either through a um, radiograph laboratory result or through palpation and percussion. That's nursing assessment that we learned before. The spleen is usually large and palpable in some patients. Posterior cervical lymph nodes may also be enlarged. Okay. Now, for the diagnostic, usually the hepatitis B virus is composed of the following antigenic particles: HBCAG, HBsAg, HBeAg, HBxAg. Now, HBsAg appears in the circulation in 80% to 90% of infected patients. So this is what they will be usually be using to diagnose hepatitis B virus. So that appears in about 1 to 10 weeks of after exposure to hepatitis B virus and about 2 to 8 weeks before the onset of symptoms. So before you experience symptoms, and if you believe that you've contracted hepatitis B, you can get tested before the symptoms. Patients with HBsAg that persists for 6 or more months after acute infection are considered HBsAg carriers, or basically you are a carrier of a hepatitis B virus if you are chronic with the antigen. If the antigen has been chronically living inside your body for more than 6 months. HBV DNA is detected by polymerase chain reaction testing, which is kind of expensive, but we have to know which virus are infected. Okay, what is the nature of illness for hepatitis B virus? Those who contracted this. Clinically, the disease closely resembles hepatitis A, just like I said earlier. They may occur without symptoms, but they may also develop arthralgia. What is arthralgia? It's basically joint pain. As the picture here, it shows multiple joints inflamed or in pain. They may also develop rash, but let's not be confused because some rashes look alike that causes that came from other cause. So let's not be alarmed if you have rash that you might think that you have contracted hepatitis B. It's better to be diagnosed by the polymerase chain reaction rather than assuming that you have hepatitis B because of a rash, because rash is a common symptoms for many other disease. Okay, now what is the outcome for those who are infected? Um, it can be severe, for them. Um, because most people, 90% who contract hepatitis B infection will develop antibodies and recover spontaneously in 6 months. But another 10 patients who have hepatitis B progress to a carrier state or develop chronic hepatitis with persisting hepatitis B virus infection, which cause hepatocellular injury and inflammation, which is the cirrhosis. It remains a major cause of cirrhosis and hepatocellular carcinoma worldwide. So the fatality rate is higher from 1% to 10%. And again, carrier state, very easy to transmit, especially for those uh, um, um, not very careful with um, their practices of uh, drug use, or those who are very in close contact with blood. And there are, again, increased risk for chronic hepatitis, cirrhosis, and hepatic cancer. Now, what is our medical management for those who have hepatitis B virus? Our goal of treatment are to minimize effectivity normalize liver inflammation and decrease the symptoms. Because who would want to have big blown symptoms, big suffering? Alpha interferon, as the single modality of therapy, offers the most promise um, procedure to treat hepatitis B virus. Alpha interferon is produced by white blood cells other than the lymphocyte. All interferons, what do? They inhibit the viral replication by interfering with the transcription of viral nucleic acid. Okay. Now, the alpha interferon is usually administered by injection and has significant side effects. The significant side effects include fever, chills, anorexia, nausea, muscle pain or myalgias, and fatigue. The late side effects, these include bone marrow suppression. This is the only problem. Prone, high risk for osteoporosis, thyroid, thyroid dysfunction, alopecia or thinning of the hair, or balding, and bacterial infections. Now, activities are restricted until the hepatic enlargement and elevated levels of serum bilirubin and liver enzymes have disappeared. So basically, as much as possible, bed rest. Okay. Okay. Because the reason for that is proteins are restricted when the liver's ability to metabolize protein byproducts is impaired. As you can see, demonstrated by the symptoms of possible jaundice. Okay. We also have antiviral drugs that we give, the Viduvin and Hepcera or Adefovir. This is Hepcera, by the way, and this is interferon that they inject uh, to those infected with hepatitis B virus. Um, and nutrition is something that the medical team has to tackle to make sure that the patient will have no malnutrition. Okay, what is our nursing management? The nursing management is that we have to understand convalescence or the recovery period may be prolonged with complete symptomatic recovery, sometimes requiring 3 to 4 months or longer. And during this stage, usually the gradual resumption of physical activity is encouraged after the jaundice has resolved. So once the jaundice has resolved, we encourage the patient to progressively ambulate to regain back the strength. The nurse identifies psychological issues, psychological and psychosocial issues and concerns. Why? Because particularly the effects of separation from family and friends, because the patient sometimes has to be um, not really isolated, but a precaution to prevent more spread to other family members. So if the patient is hospitalized too during the acute and infective stages, okay, and then advice about sexual contact to be avoided when the patient is infected, because obviously if the patient is not treated with the vaccine or the interferon or the antiviral medication, the patient who contracted HBV has a higher risk of being a carrier and may transmit it to other people if vaccine or antiviral drugs were not taken. Planning is required to minimize alteration in the sensory perception. NARS makes measure to reduce anxiety of family members, because maybe the family members doesn't really understand the nature of this infection, so we have to do health teaching and that they may understand on how to prevent and how to treat, how to care for their loved ones, so that they may not be overwhelmed and stressed out, and reducing the anxiety. So now, the nursing management does not only happen in the hospital, it can happen also in the home and community-based care. Now, teaching patient self-care. We need to teach the patient because of the prolonged period of convalescence, right? The patient and the family must be prepared for the home care. Home care. Okay, we need to do follow-up visits by a home care nurse that may be needed to assess the patient's progress and answer family members questions about disease transmission. And a home visit also permits access or assessment access so that we can assess the patient's physical and psychological status and the patient's family. It gives us the time, the opportunity to understand the importance of. Oh, it gives us the opportunity to give the family the importance of adequate rest and nutrition for their loved one who is infected with HBV. Okay, let's advise those who made contact with the patient a prophylaxis to make sure they will not be infected. Okay, and then again, for those who are infected, avoidance of alcohol. Let's not put so much stress to our liver. And during this teaching, home care, um, nursing care, the continuing care will be just follow up to their home care, to their homes or places. And then we have to reinforce previous instruction to make sure that they are following the guidelines and protocols or principles of preventing the spread of the virus. Now, speaking of the preventing the spread, how can we prevent? Obviously, the goal is to interrupt the chain of transmission. That is the basic and most effective way of preventing the spread of the virus. To protect people at high risk with active immunization through the use of hepatitis B vaccine. So those who are at high risk, those who have multiple sex partners, those who are working the medical field, who handles and are in contact with the fluids and blood, um, usually this is recommended for them to have the hepatitis B vaccine. And then use passive immunization for unprotected people exposed to HBV. So that's the immunoglobulins or antibodies for those who has been exposed, which are the family members in close with the patient. Let's continue with the prevention. We continue the screening of blood donors. That's why if you experience to have given or donated blood, usually the blood is not given to those who will be receiving them. It's usually tested for possible infection like HIV and hepatitis viruses and other blood-borne diseases. The use of disposable syringes, needles, and lancets, and the introduction of needleless IV are used also. Good personal hygiene is fundamental to infection control. Gloves are worn when handling all blood and bodily fluids. So you guys can see here, he is just um, getting blood, but he is using gloves. Patient education regarding the nature of the disease and its infectiousness and prognosis. That is very important so that they will be compliant on how to prevent the spread of this disease. For the active immunization as a mode of prevention, is recommended again for individuals at high risk. Individuals with hepatitis C, we will talk soon, and other chronic liver diseases should receive the vaccine. Why is that? I will tell you about later why the hepatitis C virus usually is prevented by having hepatitis B vaccine. Again, the vaccine, active immunization is recommended for people under STD evaluation. So if you're a patient or a patient is being evaluated for sexually transmitted disease or has a sexually transmitted history, multiple sex partners, or homosexual man, it is highly recommended because they are very high risk. Okay, the passive immunity. Hepatitis B immune globulin provides passive immunity to hepatitis B, okay, and have never received hepatitis B vaccine. So those who have never received hepatitis B vaccine, they need this. Specific indication for post-exposure vaccine with HBIG or the immunoglobulin includes inadvertent exposure to the positive blood-containing virus or transmucosal. So let's say the person got needle prick injury and um, the patient is with a HBAG positive blood or infected with hepatitis B. These people or the healthcare provider needs to get the immunoglobulin shots. And then those people who had sexual contact with a patient with HBV or hepatitis B virus, and those who are exposed to the delivery room, and especially the mothers, obviously, need to, um, or the baby, need to have prevention. So the baby are usually given the vaccine, or and then for those who got splashed by blood, especially in the eyes. So it's important to wear goggles during delivery. They will be given this passive immunity. Now let's talk about hepatitis C virus. Remember how we can prevent this is by getting a vaccine of hepatitis B. Why is that? I'll talk about that later. So this is hepatitis C virus. As you can see, they all look the same just like the other previous one. Transfusion of blood and blood products. This is the mode of transmission. Um, exposure to contaminated blood through equipment or drug paraphernalia. Transmission possible with sex with infected partner, obviously, um, especially if the coitus will cause abrasion, which exposes the papillary surrounding the mucosal tissue. Those who are risk increase with STD. So if you have STD, um, there's a higher chance that you can easily transmit this hepatitis C virus. The incubation period, it can be short, but it can last up to 160 days. Okay, with continuing, I had a error. This is supposed to be H hepatitis C virus. Okay. Okay. What is the assessment? It's similar to HBV or hepatitis B virus, but it's usually mild, so you don't have all the symptoms. The diagnostic procedure is serologic assay, molecular virologic assay, and the antigen test or um, the DNA DNA, the polymerase chain test that tests EI antigen. The patient for them usually they experience loss of appetite. Again, dyspepsia, abdominal pain, generalized aching, malaise, and weakness. Jaundice may or may not be evident. If jaundice occurs, light-colored stools and dark urine accompany it. The liver may be tender and enlarged to 12 to 14 centimeter vertically. The spleen is enlarged, but again, it can be mild. Okay, it doesn't have to be all these symptoms for HCV. Okay. Now, again, this is supposed to be HCV. Okay, the signs and symptoms similar again to HBV or hepatitis B virus, but it also is anicteric, so you don't have to develop jaundice. Okay, okay. Now the outcome, what is the prognosis? Usually frequent occurrence of chronic error state and chronic liver disease. So that's only the sad part there. And increased risk of hepatic cancer. So what is the medical management for this? Interferon and ribavirin hemolytic anemia. For the hemolytic anemia, the most frequent side effects. Um, is the hemolytic anemia for interferon and ribavirin. And the most frequent side effects, however, may be severe enough to require discontinuation of the treatment. Ribavirin must be used with caution in women and childbearing age. Okay? Nursing management, basically health teaching, what we have learned from hepatitis A and hepatitis B can be applied with hepatitis C. And all hepatitis viral infection can be applied because it's affecting one organ, which is the liver. Okay, the prevention of this is screening of blood, especially for those who are donors, because screening of blood has gave an evidence that it can reduce the incidence of hepatitis associated with blood transfusion. And public health programs are helping to reduce the number of cases associated with shared needles in illicit drug use. Okay. Now, the Delta agent, hepatitis D virus. Mode of transmission, same as hepatitis B virus. Um, HBV surface antigen necessary for replication. Actually, I was wrong earlier when I said we need a hepatitis B vaccine to prevent hepatitis C. I miscommunicated. It's supposed to be the HDV. Because if you have HBV, the HDV virus can only replicate if there is HBV. Okay? So if you don't have HBV through vaccination being immune to it, the HDV cannot live inside the body or replicate inside the body. Now the pattern is obviously similar to that of hepatitis B. This is the hepatitis B and this is HDV. So they have the same antigen that they will be using for hijacking liver cells for further replication. The incubation is for 3 weeks to months, 21 to 150 days. Okay, assessment usually um, it's diagnosed by the anti-delta antibodies in the presence of HBAG on testing, which confirm that you have the virus of delta virus or HDV, hepatitis D virus. Okay, HDC. The nature of illness is similar to HBV. So C, D, actually they all are similar from A, and then the succeeding one is similar to the previous one. So the C and D is similar to B. Okay. Okay. The outcome is this, but greater like is similar to HBV, but greater likelihood of carrier state, chronic active hepatitis, and cirrhosis. This is a normal liver, and this is the liver with cirrhosis. It looks very poor. Usually it shrinks. Now, the HDV management. Treatment is similar to that of other forms of hepatitis because it's the same problem, the liver. Chronic hepatitis D is usually treated with pegylated interferon. Interferon as a specific treatment for hepatitis D is under investigation. So usually it's treated just by pegylated interferon, but um, interferon that is specific is still under investigation. And then we can prevent by not being infected with hepatitis B. Just like I said, so get hepatitis B vaccine. And other preventive measures include avoiding exposure to infected blood, contaminated needles, and so on, just like how we try to avoid hepatitis B. Now, the mode of transmission. Fecal oral route, person-to-person contact may be possible, although risk appears low. Now, this is for HEV because this is usually in the developing countries, and the incubation period is variable, estimated to range between 15 to 65 days. It's like hepatitis B virus earlier. So the signs and symptoms, this one refers to HIV. However, very severe in pregnant. So this one is ecteric. Okay, you will have jaundice. Similar to HIV is the nature of illness, but severe if you are pregnant. Usually mild with recovery, fatality rate, like the hepatitis A virus, less than 1%, no carrier state or increased risk of chronic hepatitis, cirrhosis, or hepatic cancer. So only B, C, and D that will give you this high risk of cirrhosis and hepatic cancer. HIV management. The effectiveness of immune globulin in protecting against hepatitis virus is uncertain. Okay? Very uncertain. Okay? HIV prevention. Avoiding contact with the virus through hand hygiene, hand washing, and making sure that you practice this if you are in a developing country because of the poor sanitation and poor sewage control. Now, points to remember. Viral hepatitis is inflammation of the liver caused by the hepatitis A, B, C, D, or E viruses. Depending on the type of virus, viral hepatitis is spread through contaminated food or water, which is the A or E, contact with infected blood, which is the B, C, and D, sexual contact, B, C, and D, contact with an infected person, A, B, C, D, or E, can, or from mother to child during birth, B, C, D, all that, especially B. Vaccines offer protection from hepatitis A and hepatitis B. No vaccines are available for hepatitis C or D and E. Reducing exposure to the virus offers the best protection. So let's not rely more on the vaccine, but reduce our exposure. Sucks for the healthcare people. Hepatitis A and E usually resolve on their own, so let your immune system fight it. Hepatitis B, C, and D can be chronic and serious. That's why use immunoglobulin or interferons or antiviral drugs. So drugs are available to treat this chronic hepatitis. So if you are treated, you will not experience or you will be at low risk for developing chronic and serious complications. Okay. Now let's go for nursing care plan. Let's say we have three nursing problems, but we will just focus on one main problem that is always being tackled as a problem with those infection with hepatitis, viral hepatitis. Now, assessment. Usually the patient will verbalize loss of appetite in anorexia. The objective data is that patient, because of the loss of appetite, will refuse to eat. They will be weak because of malnutrition and they will be fatigued and reduce body weight because of malnutrition, abdominal pain because of infection and the inflammation of the liver, and dry or yellow skin because the liver cannot um, uh, uh, metabolize the bilirubin properly. Okay. So what's our nursing diagnosis for anorexia? Imbalanced nutrition less than body requirements. Intake of nutrients is insufficient to meet metabolic demands evidenced by weight loss. So this is an imaginary patient. Rationale for that is that anorexia is an early symptom of viral hepatitis, which is often severe when patient often has an aversion to food. So if the patient loses appetite and doesn't want to eat, anorexia happens. So what's our goal? Let's say there's a patient suffering with this situation. So usually, if the patient has lost weight, my goal would be after 3 to 7 days of nursing intervention, the patient will demonstrate progressive weight gain toward normal body weight with normalization of laboratory values and no signs of malnutrition. Now with that goal, what is our nursing intervention to achieve that? We monitor dietary intake and caloric count, suggested small frequent feedings, and offer largest meal at the breakfast. Why? Large meals are difficult to manage when patient is anorexic. Anorexia may also worsen during the day, making intake of food difficult later in the day. Next, provided mouthcare before meals. Rationally, it enhances the appetite by eliminating unpleasant taste. Assisted eating in upright position so that we can facilitate downward gravity pull so that and the patient will not have abdominal fullness when they eat. Continue with the nursing intervention. We encourage the client to intake fruit juices, carbonated beverages, and hard candy throughout the day. This will act as a supplement for extra calories and may be more easily digested or tolerated other than solid foods. Monitor serum glucose if indicated by the physician, because this will tell us what therapy will be changed or will be added depending on the amount of glucose that the client has. Administer supplemental vitamins as prescribed if the physician thinks it's necessary. This will correct the deficiencies and aids in the healing process of the patient. Now, if we do it all right and the patient complies, we should have a goal met. It can be up to 3 to 7 days of nursing intervention. The patient was able to recover his or her normal body weight and achieve normal laboratory values without signs of malnutrition, only if we do it right and the patient complies.